Hello, everyone. Welcome to the webinar. We're happy to see everyone that is here and really excited to host our set of speakers today who will be talking about a really wonderful new book that's out called The Policy Evaluation in the Era of COVID-19. It's edited by Eliadis, Indran, Naidoo, and Naidoo Rist. And as I mentioned, we have several speakers who've authored chapters and contributed to this book with us today. So I'm Leslie Fierro. I am the Sidney Duder Professor of Program Evaluation at the McGill School of Public Policy at McGill University. And I'll be moderating this event, as you may have gathered. We'll be joined by several speakers, the first of whom will be Mariel Aramburu. She is a partnerships officer at the United Nations World Food Program, and she'll be talking about meta-analysis of evaluation, key trends, and learning during COVID-19. We're then joined by Indran Naidoo, who's the director of the Independent Office of Evaluation of the International Fund for Agriculture Development. And he served as the director of the Independent Evaluation Office of UNDP and Deputy Director General of the Office of Public Service Commission of South Africa. He's a globally recognized evaluation thought leader, speaker, manager, and author who has spearheaded international reform initiatives. And he will be speaking about implications for evaluation, what we learned from the UN and country COVID-19 response plans, and reflecting on future scenarios. Welcome, Indran and Mariel. Then Steve Montague, who is the partner of Performance Management Network, Inc. He's a credentialed evaluator, a fellow of the Canadian Evaluation Society, and has 4 decades of experience as a practitioner in performance measurement and program evaluation, as a management consultant, an adjunct professor, and as an evaluation manager in a major Canadian federal government department. He'll be joining us to speak about COVID crisis time to recalibrate evaluation, chapter he authored with Maria Barrados and Jim Blain. Welcome, Steve. Eliadis, who is associate professor here at the McGill School of Public Policy at McGill University. She's also a lawyer with an international law practice in human rights, national institutions, and democratic governance. And she's worked for organizations such as the UN and OECD on a range of issues at the intersection of evaluation and the rule of law. And accordingly, she'll be presenting her chapter that talks about the unbearable lightness of rights, evaluation ethics, and COVID-19 responses. Welcome, Pearl. Robert Lahey will be joining us. He's the president of REL Solutions, Inc. and founding head of the Canadian Centre of Excellence for Evaluation. He has advised globally on capacity building and of national monitoring and evaluation systems and evaluation use and supporting implementation of the SDGs. And he's joined by Dorothy, who's the executive director of Sustainable Development Facilitation Global, a social enterprise that's based in Australia and supports strategic and evidence-based sustainable development processes globally, including active evaluation practice and complex contexts. Dorothy's a credentialed evaluator as well, and a fellow of the Australian Evaluation Society. Dorothy and Robert will be presenting on their chapter, which is entitled The Impact of the COVID-19 Pandemic on the Effective Use of Evaluation in Supporting the Sustainable Development Goals. Jeremy Lonsdale will also join us. He's the former director of the National Audit Office in the UK until 2021, latterly being responsible for defense value for money studies. He worked on secondment as a senior research leader at RAND Europe from 2014 to 2016. And his publications include, as the co-editor, Performance Auditing, Contributing to Accountability in Democratic Government. He'll be talking to us today about his chapter entitled Knowledge Production in a Pandemic, Supporting Accountability at Pace, United Kingdom and Canada. And then last but not least is Naidoo Rist. He was one of the creators and co-directors of IPDET and also a former president of the International Development Evaluation Association, which many of you will perhaps know better as the ideas. He's retired from the Independent Evaluation Group of the World Bank. And Ray continues to advise organizations and national governments throughout the world on how to design and build results-based M&E systems. And he'll be joining us to give an afterword following the chapter discussions. So welcome all again. We're excited to hear from you and learn about your exciting work. How this will run is you'll have your presentation. Those of you who are joining us as participants, please feel free to type your questions in as we go along into the Q&A or the chat. We'll monitor those. If there's anything that seems really pressing and needs an answer straight away after the presentation, I'll pose the question. Otherwise, we'll wait till the end to respond to the Q&A. If you can put in your Q&A or your Q, not your A, but your Q. If you can also write who the question is to, that would be very helpful to Weston and I. Thanks so much, and we'll get started with Mariel.
Thank you very much, Leslie, and hi, good morning to everyone, or afternoon or evening, wherever you may be. It's a true pleasure to share this space with everyone here. I'll go ahead and share my screen, and then we can go from there. So you should be able to see it now. There we go. Perfect. So what I'm going to be touching on, as we mentioned, is a meta-analysis of evaluation, key trends and learnings during COVID-19. And so I conducted a survey of grey literature to support the overall book development and authors' chapters and own research in the policy evaluation in the era of COVID. So to give you a sense of kind of these next 10 minutes, what I'll be touching on is a bit on the methodology of this meta-analysis, some key themes that really emerged, and then just a few reflections. There we go. So to start off on the methodology, as I mentioned, it was a web survey of grey literature from international organizations, agencies, and evaluation societies in English or Spanish, which are my two languages that I speak. If we go back to, really, I think the heart of the pandemic, the thick of the pandemic, it was looking at research that included resources up to and including February 2021. And so I think you'll see, as we discuss some of these themes, where we're at now and be able to reflect a bit, but really, I think, put yourselves back in February 2021 and just really reflecting at the thick of the pandemic and how you were feeling and maybe in your practice and evaluation, what was going on at the time. So I did a sample of multilateral development banks, United Nations agencies, regional evaluation societies, and country level societies. And so initially I was looking at 33 bodies, and due to the limited nature of relevant material of some of these bodies, we narrowed it down to 17 that really had produced content. So some of these other bodies had maybe produced webinars or were sharing materials, but these 17 bodies really had more material to draw upon. And then of course, it really is just a general in time. As you know, things were evolving rapidly, changing rapidly, and so really just a general snapshot in time. So the first theme that I want to draw upon is evaluation architecture. And so really redefining evaluation principles, procedures, and communication. And so when we were looking at what changes to work planning were happening at the time, we were looking at evaluations that were being conducted in a remote or semi-remote setting. I've found, that it wasn't always less costly to do these remote or semi-remote modalities, because savings maybe not pursued from international travel, were maybe countered by an increased workload for international consultants or the need for an increased number of national consultants. when looking at real-time evaluation, a particular debate emerged with the World Bank and the Asian Development Bank looking at, did we need a new mindset regarding the independence of evaluation offices, given the real-time evaluation in crisis settings may require working perhaps more closely with implementation teams versus, the importance of maintaining that independence. And with collaboration and communication, one important example is the COVID-19 Global Evaluation Coalition, which really emerged at this time, and it's made up of central evaluation units from around the world. And it really emerged, with the heart and the purpose for collaboration, communication, and exchange of ideas and practices and learnings. So as we go into the second theme of tools and methodologies and, perhaps measuring that evaluative impact in the, what was the current and then now post COVID-19 era, we're looking at, of course, an increase around desk-based assessments. So discussions around desk reviews, reliance on secondary data, discussions on the use of a flexible team approach. So, are we able to leverage more locally based think tanks, research and academic institutions for data collection who may have already been in country, looking at technology and data sources. I think one interesting element here was discussions around big data and how we could maybe use social media to gauge the sentiment of specific groups. And I think along with this and the authors of this edited book, you'll see a lot of conversation around geospatial data was emerging. And I think taking that and looking into in practice what was actually being applied. And so I think sometimes there was perhaps a divide between what could be and what was able to be applied immediately. And so there was an interest by some bodies to look at an increase in geospatial data. But however, that was also being looked at what are the current skills of evaluation practitioners. The World Bank proposed piloting some of these methods, while at the same time recognizing that there is a need to understand the potential integration of geospatial data, the need for organizational dialogue, and then finally triangulation. So of course, evaluations rely on mixed methods, qualitative and quantitative, and the importance at this time of triangulation, so really cross-checking different sources of methods to find confidence in your findings. When we're looking at ethical considerations and human rights-based approaches, there was of course, an increased risk of bias. And so several groups were noting that if data is being collected remotely, the risk of bias increases due to unequal access to communication technology, among several other factors, especially for vulnerable or marginalized groups, rights-based evaluations. So UN Women spoke a lot about prioritizing the engagement of rights holders in defining the issues and solutions from their perspective. And importantly, the Australian Evaluation Society also posed the question, whose voice is missed if we draw only on existing data? And so as we saw a movement of perhaps using existing data or data that was available, whose voice was being missed in those moments? And of course, the principle of do no harm was frequently cited. And UN Women also discussed weighing the benefits and risks of perhaps using other forms of data or halting an exercise altogether versus perhaps the risks of engaging with disadvantaged or marginalized groups at the time. Supply and demand was also a recurring theme and conversation in the bodies that the gray literature that I looked at. So really demonstrating the value of evaluation in contested contexts and the need to ensure value. And so this no kind of business as usual approach and just this change in mindset. And so the UNDP spoke to reprioritizing evaluation strategies to really ensure value in the context of COVID-19, stressing the importance of evaluation, especially given the significant amount of spending that was taking place and funding at a time, and really given the quick pace that there could be a perception that evaluation could be seen as irrelevant, given how quickly it was processed. So really discussing, how do we reprioritize evaluation strategies to ensure the value of evaluation in the wake of COVID-19. Assessing the viability, so the need to assess how evaluation could remain useful. So examining the availability of stakeholders, those barriers to data collection activities, the timing, the budget of the evaluation. And so we did see some bodies really consider changing those, the timelines, the priorities, and really adapting to the needs and understanding the need to perhaps lengthen those timelines or adapt them. And finally, the World Bank also posed that perhaps evaluations during this time should consider tackling questions that often were understudied in evaluations, but given the moment, they could bring particularly useful evidence. So these were questions such as coordination, coherence, partnership management, and again, all in the context of development partners coordination. And I wanted to kind of the last theme, and I purposefully put it kind of near the end, was preparedness for the future. And so I think this is something that we can reflect on now, kind of looking back that these conversations were taking place in 2021, already thinking about how do we prepare for the future, or what are these potential learnings? And at the same time, how do we use learnings from previous shocks and apply them to the COVID-19 context? And so there were a lot of discussion about pulling lessons from previous crises and shocks as a recurring theme. And so several evaluation societies compiled library resources in looking at shocks that included environmental, conflict, or financial shocks. The Asian Development Bank, interestingly, proposed perhaps leveraging artificial intelligence to weed through the amount of learnings and kind of historical learnings that existed. And we didn't see it kind of play out, but that was something that they were mentioning or proposing. The Global Evaluation Initiative, this was a new partnership that emerged during the pandemic, and it wasn't a direct response to the pandemic, but something that emerged during the pandemic. And it's really focused on coordination, national capacity in measurement and evaluation, and then continuing revised practices. So how do we apply those learnings to this post-COVID evaluation work plans and practices? So we see IPDET discussing some of the learnings that could be applied in normal times. And so how do we reduce carbon footprint through changing our travel behavior? How do we leverage technology for interviews? How do we do more robust planning when there is country missions taking place? How do we ensure robust literature reviews or desk research before perhaps in-country missions? And how do we leverage and grow that national capacity? And so just to end with some reflections, and I think some questions that we'll see being revisited and perhaps some answers from the authors sharing of their chapters, but really questions of what learnings have been and continue to be integrated into evaluation practices. I spoke to the establishment of the Global Evaluation Initiative, and they've also been speaking about, going back to supply and demand, this growing demand for evaluation capacity, coupled with the need to support local and sustainable supply of evaluation capacity development services. And the COVID-19 Global Evaluation Coalition, which we spoke about kind of earlier on, they've now turned kind of their resources and their attention to evaluating the response. And so I think some of the attention has perhaps gone and focused on other things, but the COVID-19 Global Evaluation Coalition, now they're doing a joint evaluation on the collective international development and humanitarian response to COVID-19. And so this is in progress. They just started it spring of this year, and then they expect their findings to be shared in 2024. And I will also just end with my contact information. Would be very happy to share some of this meta-analysis with you, any questions. And again, it's a true pleasure to be among these authors and having had the opportunity to work together with them. And I'll turn it over to Leslie.
Thanks so much, Mariel, for your presentation and your analysis. It was really great and really nice to way to set kind of a backdrop, and really great to see the types of things that the evaluation community was thinking about and is continuing to think about in reflecting on the COVID-19 time period. So thanks so much. I don't see any pressing questions, so we will go on to the next speaker, Indran.
Thank you very much, and greetings, everyone. So I'm going to reflect on a chapter, and it's been an honor to work with Pearl, Mariel, and Ray on this. During the lockdown period, after my term as director of the Independent Evaluation Office of UNDP, and as a volunteer, I was asked to provide an assessment of the joint UN and government socioeconomic and response plans. And this is a set of documents that were put in place, led by the SG's office, to mitigate risk and help recovery. Over a period of a few months, while the lockdown was in, I assessed over 100 of these plans, and combined with an understanding of how evaluation works in the UN system, my previous role as a vice chair of the United Nations Evaluation Group and also leading the National Evaluation Capacity Series, I examined these reports from the perspective of evaluation. So I produced individual reports, and then it was aggregated to inform this chapter. Now, as joint plans, which were constructed between government and the UN system, or the resident coordinator, the person who brings together all the UN agencies, these plans were meant to help mitigate risk. So it reflected the situation as it is, it calculated what the risks were, and it also worked out what is the best way to move away from the crisis. In other words, it was a plan to assess the impact of the crisis and also to redesign and repurpose policies and strategies to what is called to build back better. Now, as you would all know, that's easier said than done. But it was also accepted during this period that the attainment of the Sustainable Development Goals, which had made a lot of progress as measured in the National Evaluation Capacity Conference, the last at the time was 2019 event in Egypt, that these were simply not going to be attained. And this was anticipated. It was also accepted internationally that the gains that had taken decades to achieve would be lost. It was and remains a development challenge throughout the world. And I think it's the statements to the effect that the attainment of 2030 is simply not going to happen. So to introduce the readers to the chapter, it's really reflective of how evaluation has evolved to date, but it also makes a commentary on how responsive the evaluation sector has been during that crisis. And the chapter also notes that the crisis brought to the fore existing inequalities, which were exacerbated, including those related to human rights. The lockdown that occurred across the world, it also redefined economic and social relations. Much has been written about these. This chapter asks the pointed question: where was the formal evaluation community, the dedicated units within agencies during this period? Now, understandably, it was not possible to travel, engage in field missions, and evaluation plans of the various UN agencies were put on hold. But what does this say about the activity and capacity in place, which went to a period of dormancy when it was not at the forefront, when there was a need for information, a need for skills to inform the UN socioeconomic response plans and help build back better? So one would assume that the knowledge in place and the volumes of reports that were generated would inform the UN socioeconomic response plans. yet there's very scant mention of them, or even the word evaluation in the plans, as Mariel has also done. This chapter argues that post-COVID new realities across the globe will call for a reorientation of evaluation as a practice, and as it has forced to the fore a whole lot of issues. Firstly, there is a need to be strong on monitoring and being able to access more forms of information for immediate purposes. The role of artificial intelligence cannot be undermined. Big data is important, and this is the information that's more likely to inform policy decisions than waiting for a long period of time for a discrete evaluation report. And this is whether the report emanates from the IFIs or the United Nations Evaluation Group or elsewhere. So we're looking at the issue of the immediacy and the long term. Secondly, that the notion of long time frames to look at matters and make a judgment, that's the past. Average evaluation taking over a year, then you get a result and then it feeds back into the system for change is not going to work, right? We have shorter time frames, and the challenge is how to produce quality work within the shorter time frames in order to remain relevant. So whilst in the past it was very important to have this more reflective moment, it needs to be replaced by the need to be relevant. And this involves what have been mentioned, a multi-actor approach and perspectives, multidisciplinary approaches. So there's no longer the exclusivity on performance appraisal that evaluators have. There are now new sectors that have moved into the space, and I would add quite successfully, and needs to be acknowledged. This is the research, consultant, academic sector. So this chapter took an evolutionary perspective, and it noted the following. Firstly, whilst evaluation has historically evolved in a context of demand and supply, and has previously been driven by donor interest with an emphasis on accountability, this has changed. The good part is the Paris Declaration on Aid Effectiveness, which emphasized self-determination and sovereignty while successful as far as evaluation goes. And that has been reflected in the UNDP National Evaluation Capacity Series, which began in 2009, and each year became stronger in terms of giving the largely global South an opportunity to talk about their practice and to train each other. Historically, it's the largest constellation of country actors in a network globally. And many new methodologies have been put onto the table. And also there's been much gains in capacity and policy to use evaluation for improving development effectiveness. So we've moved a long way from where the skills were generated in one part of the world and transferred to another part. Skills are generated across the globe, and that really reflects the way in which education and the evaluation sector has evolved. And various approaches need to be taken on board. I think also the fact that there are now evaluation journals from the global South reflects this reality, and it also reflects the fact that the preserve of what constitutes evaluative excellence no longer resides with any part of the world. It's actually spread out. But we also need to note that while the evaluation profession grew, I would say in the last 20 years, and there's many statistics to show so, and evaluators had developed until then a very good reputation. During the COVID-19 crisis, as the socioeconomic response plan showed, the input of evaluators was very limited, almost non-existent. And as a profession, they were largely absent. And the very critical monitoring data generated and used for recovery came from non-traditional actors and sectors, non-evaluators. And really, academia and the research sector showed an ability to do so quite successfully. This was a missed opportunity for evaluators, but I do believe that moving ahead, they would have to recast and actually begin to work in a multidisciplinary way, in a much more fluid context, and to recognize that the old order of taking your time to produce an evaluation and hoping something changes, that has gone quite fast. Now, in the post era, there are now new realities. It means that the evaluation sector, in the UN especially, which tends to work at an agency level, just generating results for the interventions of that agency, has failed to take into account the holistic manner in which development rolls out. And it's also failed to work at speed. So in the future, it needs to work across agencies and actors. We've heard of one UN, but that does not apply in the one UN as far as evaluation goes. The question is, does the current training and methodological emphasis assist this? Is the focus too much on methods in the sense of research and tools, and not enough on the need to also have a capacity to engage and to co-create, to become more solution-oriented and not just focus on accountability, results achieved, not achieved, because results is much more complex than the intervention. Now, the absence of mention of the evaluation sector in most of the UN socioeconomic response plans is really telling of their relevance during that period. One would have expected the large body of evaluative work to be cited or used in the recovery plans, but this was very limited. The period was marked by actors who were good at generating data at speed. Large research academic institutions, they moved to the forefront. They were used by government. They were able to produce rapid information and actually look at the entire country. They continue, and as the socioeconomic response plan shows, we're now in the era of large amounts of data. We draw on big data, there's artificial intelligence, and this is needed for any government realignment. So we have moved away from the project or program-specific work generated by evaluators. It really fell short of the new bar needing information that can bring about real solutions in a crisis context. Now, the review conducted an assessment of the comprehensiveness of the plans in terms of how data informed they were and how they sought to promote human rights and reduce inequality. Issues that were looked at in the plans included that of environment, economic dependencies, and the impact of value chain disruptions, all of which continue today. So evaluators need to look at a new baseline, and the baseline is what happened post-COVID. A few lessons. Firstly, the traditional evaluation ecosystems need to change. It remains project-based in thinking. It assumes linear thinking and practice, and has been shown to not reflect dynamic and new development paradigms, which are also not easy to measure due to interconnectivities. And that complexity needs to be grappled with. Secondly, the demand from governments is really to be action-oriented, or even those that receive aid, which often cannot be delivered through traditional evaluation models. The forms of data required are more complex and larger than evaluation units can generate, and methods to test the impact of interventions are often disconnected from country realities. Thirdly, the focus on specific agency work is simply not agile enough for new realities. The talk of one UN and working across sectors remains talk. For a short period, the agencies came together, and now seems to be back to the old silo approach. Next point, 4. Evaluators have traditionally worked in a predictable environment with clear policies and protocols. They've also had long time horizons before generating results. But this has changed, as they may not be fit for purpose unless rethinking approaches and craft. And what that means needs to be worked out. There are no easy answers to this. The next point, we have great interconnectivity, and working in flux is not what evaluators appreciate. They like stable environments. The constant crisis and constant change being experienced means a new form of working, including working with think tanks and coalitions, and moving away from the view that evaluators possess exclusive rights to judge and hold to account. So working with scale is not easy, and we do have to work with scale, and evaluators with their focus more on project and program have not appreciated how scale impacts results. The next point, as we have found, data is not automatically objective or available. The digital divide persists, gets worse, and all data needs to be viewed with circumspection. We know in terms of the information era what this means. The next point, the generic set of knowledge that many evaluators have does not make one effective. It's inadequate. And the plan showed that there's a need for specialized knowledge, and hence the need for team approaches to work. In the new context, 3 things are needed. Firstly, an agility and ability to work collaboratively across and among sectors. Secondly, being able to secure specialized knowledge for teams when you don't have it. And really a new thinking on collaboration. and being able to work in co-creating knowledge for all of society approaches to bring back the utility. This period has shown quite a superficial response by evaluators. There now is a need to retool to be able to work across sectors and at speed, and to recognize that evaluators no longer have the exclusive space in making program judgments. That's with social media. So this chapter has called for rethinking approaches and for evaluators to ask, can they answer bigger and more urgent questions, or have they been overtaken by reality in terms of their own relevance? Thank you for your attention.
Thank you so much, Indran, for that very thoughtful reflection and analysis. For us, certainly as an academic, it certainly gives me a lot of food for thought in training future evaluators and what that space may need to look like in the future. I really appreciate that. I again don't see any burning questions that we need to address. So we will move on to the next speaker, who is Steve.
Thank you very much, Leslie. And this actually couldn't come at a better spot in the agenda. I just want to say that I note that I'm speaking to you from Ottawa, which is the unceded territory of the Anishinaabe people, who were known for their flexibility, actually. And as such, I think that is very much a watchword that you'll hear more of in this meeting. And I also want to say it's a great privilege to speak with after both Mariel, who did a great job briefing some of our students a couple of years ago, and Indran, who was a marvelous host as well as a deep thinker in terms of Interval work this past year. So I also want to mention that Maria Barrados was really the lead on this. She can't be with us to help today, but Maria, I know, would acknowledge that we're I think making the right progress, and I'll keep it very simple. I won't pretend to do justice to what she would have said in her specific spots, but I'll do my best to give you. I'm going to go and share my screen if that's okay, because I've got a one addition to what I had given earlier. So I'm going to go through that. If people can see that all right, I'm going to proceed in terms of this presentation. It's very clear that, as Indran just said, there's no more business as usual for evaluators and evaluation functions. So I'm not going to recast that. I'm going to give you 3 cases from the Canadian context where we think there are very promising emerging practices that we can build on. So we're going to take for granted that we do need to change from what we've been doing in terms of a function. And we're going to try and share some ideas about 3 ways that we've seen this start to happen, give you the observations from that and the implications going forward. We basically have a need to recalibrate. And so we're going to talk about 3 ways to recalibrate evaluation. The first is timing. You just heard Indran say that the old ways of doing studies over a long period of time are just not sufficient. Now, there have been people admonishing us to do this for quite a while. Our cleanup speaker will likely speak to that, and certainly anybody who's read Ray Rist's work over the years knows that studies are not enough, and that there needs to be a lot of complementary work that needs to be done. I think this is more so now than ever. We're going to talk about the case from COVID, from Canada, where that was attempted. The other is to link with groups like Audit. And again, I won't pretend to replicate what Jeremy and Maria did in their great crossover separate book on this function, but we'll talk about a specific case to Canada where this worked well. And then finally, looking at defining and tracking patterns to develop early warning systems for failure that can serve management in real time. Those are the 3 messages. The real-time support has to do with, again, what opened at Public Health Agency of Canada, Health Canada, in the early summer of 2020. Essentially, the ex post facto review of the Office of the Auditor General was that Canada was not well prepared for COVID. It has a unique and distinct environment in terms of information sharing, which others can likely speak more eloquently to. But suffice to say that there wasn't a great amount of good surveillance about the development of this disease in Canada. As such, therefore, the evaluation function, led by our good friend and colleague and fellow of the Canadian Evaluation Society, Shelley Boris, among others, formed tiger teams to serve the Chief Public Health Officer. And within a month and a half, essentially came up with 5 themes where they did some analysis and did serve the ongoing needs for management in that critical time in mid-2020. They created simple, structured, rigorous, real-time capture of mainly qualitative information, because as Indran rightly pointed out, and this was the case in Canada, the quantitative data was spotty at best, and therefore they got qualitative impressions from people who would know, but they did it very rigorously. They looked at background and context extensively, but they also did multiple persons in the interview so they could capture appropriately the gems of information that were there. They looked at what worked well. They looked at challenges, which anyone who works around government knows that's code words for the gaps and weaknesses. And they looked at suggested improvements. So the write-ups, which are available, will tell you something. But the real value was in the direct briefings and in the direct process. And again, I would defer to the groups involved to tell you more. But it was quite a change for evaluation to be able to do this in a 1.5 month process. And I think that they need to be lauded for championing that in a world where this was not the case, as Indran rightly points out, and that was not the case in Canada. There was at least, I think, a shining example and an emerging example of something that could be followed. The second is, as noted, I will not repeat what Jeremy Lonsdale and Maria Barrados have nicely outlined in some of their work in the crossover of audit and evaluation practices, but highlight one particular area in our Treasury Board Secretariat, where they looked at privacy information protocols and practices. They did it across the Government of Canada, and they did it as a joint audit and evaluation project. It happened to work well because there were two very good colleagues involved, Nathalie Lalonde and Elena Petrus of Treasury Board Secretariat, who I give props to. And in essence, what they did was find a way to have a way to work together, and they did it through that old saw of evaluation, the logic model. This is publicly available documentation, and I like to joke with them, and for our American colleagues, that it was a bit of a red state, blue state collaboration, in the sense that you had audit and evaluation. Perhaps they would be reversed in colors if we were looking at social structures. But the point being that audit looked at things like immediate compliance with certain criteria, with certain policies, and evaluation looked at enabling environment components, the behavioral components that influenced behavior, if you like. So without going through the detail, the point is they saw this as a unifying function, as a core, if you like, of how they could both design, develop, and report on their work. So working with audit, I think in this way, really worked well. And as any of us who've worked across these functions knows, that is not all that common, that the groups can start to see their way clear. There's a marvelous little video on this if people are interested. They have to learn each other's language. They had to work well together in various other ways. But I think one of the cores of it was to have the common idea of what the program was doing with whom and why through a logic model. What they said was they would have liked to have done it earlier in the process if they were to do it again. So I think we'll see more of that. The third point that we wanted to raise, and that we see as a harbinger of things to come, is the idea of developing leading indicators. There's an example in the article from the Public Service Commission, and the idea that one would develop leading to indicators to show impact and what would happen later on. I won't do justice to that by describing it because that was not my case, but I will say that we've seen a real increase in this kind of focus. The idea that you can use early indicators of reach and engagement, for example, and then early behavioral patterns that will predict later behavioral patterns. And in some cases do more than that. Will actually, you don't pass go. If you didn't reach and influence the key groups that your program was designed to reach and influence, well then why are you bothering to try and do an elegant cost benefit analysis or impact review years down the track? You didn't influence them. And we've seen this in food safety. We've got something that shows that in fact, the food safety in Canada was being influenced by separate global gap procedures and protocols that were in fact superior to what the government of Canada was doing. We've seen that in things like administrative monetary penalties, where in some cases there was much more penalty to not doing the right thing than there was from the penalty itself. All it did was create friction in the system. So if you can look at some of the early progress, the early processes, who's engaged, what the reaction is, and what the behaviors are, and then see how those connect or don't connect to the later impacts, you can learn a lot, and you can do that in real time. All to say that the observations of these three cases come to the following. In all three cases, you needed leadership to re-envision the function, right from as high a level as you can go. And oftentimes that meant fighting City Hall, in the sense that the protocols and policies in a bureaucracy like the Canadian government are not easy to break. There is a routinized process, as Indran notes, true at the UN, true in the Canadian government, that puts evaluation into a box, into a certain type of cycle. They had to break it. They had to literally break it, often to the detriment of early performance reviews of the senior managers involved. Secondly, it's required those strong collaborations and coalitions that Indran notes. In each one of these cases, not just the audit and eval, but in the case of the Tiger teams at a public health agency, in the case of whether it's administrative monitoring penalties or food safety or others, it needed to link with those experts, need to link in a team format to collectively co-develop the answers. And that coalition and collaboration engenders a trust that is much more significant than what we may have seen in times past. And the third thing, the use of adaptable approaches tailored to the decision support needs, which means, again, real-time modeling, real-time reflection, a generative approach, as we like to call it, in evaluation. These are the three things. So, ergo, going forward, what we would see as important is to first, as Indran says, re-envision the evaluation as a way of thinking, as almost a meta approach, not a specific set of questions, approaches, and methods, as in our traditional review functions. And again, when evaluation is placed with audit or other evaluation or other evaluative type of functions, it can often be misconstrued as a series of research methods, but rather it's a way of thinking, and evaluative thinking needs to be the predominant understanding we have of what it brings to the table. We need to embrace the principles of adaptive management, of more flexibility, of learning the language and speaking the language of the groups that we're hoping to support and to work with. That includes the senior level decision makers, but of course it includes all of the stakeholders, and the voice is often not heard at the table. It needs to create that high level of engagement because we are indeed learning in real time. But I think the big but for us as evaluators is anything doesn't go. We need to maintain some key principles of an approach which values rigorous cause-effect thinking and focuses on contextualized behavior systems ahead of elegant research designs, presupposed evidence hierarchies, and precise measurement impacts and estimates. I think that's a difficult change for some folks, but it's certainly something that I think we need to foster going forward. And I think that keeps me within my time. So I'll go back and stop the share and allow us to move on. Thank you.
It does. Perfect timing. Thanks, Steve, for those insights and for giving us some really nice examples of ways of kind of breaking out of our regular mold and thinking about how we can move forward to address some of those challenges that Indran raised earlier. Really appreciate that. It looks like we're now going to move on to Pearl's presentation.
Good morning, everybody. Really great to see all of you in the room. And if I may, a special shout out to Mariel, who's also a Max Bell alumna, to other Max Bell alumna who I see in the room, and current students. Great to have you with us, and also grateful to see Interval colleagues in the room as well. So thanks so much for being here. So I'm going to be talking about the chapter, my chapter in the book, which is focused on the question of human rights in the evaluation process. The chapter is called The Unbearable Lightness of Rights, Evaluation in the COVID Pandemic, and I build on Mariel's work, which looked comprehensively at what was happening in human rights during the COVID period and also some of the developments afterwards. The bumper sticker to my chapter is really that evaluation historically has not done a great job about either understanding or integrating human rights into its framework, except as one of many principles and ethical ideas that evaluators consider. I argue that it needs to be front-loaded and given a much higher rank in the hierarchy, if you will, of evaluation practice. And I also build on Indran's observations around the importance of thinking about human rights as a broad transformative framework, of course, in support of the Sustainable Development Goals, which Robert Lahey is going to be talking about in his presentation. So authors Zenda Ophir and Deborah Rugg have argued that the pandemic presented and continues to present a unique opportunity to reimagine society and its relationship to the environment, to ourselves, and to redefine our own values. And this chapter argues that human rights law and human rights-based approaches were not and have not been centered within evaluation practice, and that this indeed continues in the post-crisis period. I think this creates a significant gap in evaluation practices that evaluators were ill-equipped to deal with during the pandemic, and sadly, this seems to have continued afterwards. So I'm going to provide a brief overview of the evidence for a weak presence of human rights in existing ethical frameworks. I'm going to talk about why evaluators should care and share with you some of the basic rules that apply to human rights in times of emergency. So the evidence coming from the book, Policy Evaluation in the Area of COVID-19, which you see here, is looked at a number of ethical frameworks, including the Joint Committee Standards for Educational Evaluations Program Evaluation, American Evaluations Association's Guiding Principles of 2018, the 2010 OECD DAC Network on Development Evaluation Summaries of Key Norms. I also had a very close look at my Interval colleagues' work, Rob Vandenberg, who I think is here with us today, who did an excellent overview in his chapter on the way in which evaluation ethics are framed. The book is called Ethics for Evaluation: Beyond Doing No Harm to Tackling Bad and Doing Good. And looking at that plus Mariel's work on the meta-analysis of 25 major international organizations, the outcomes are clear, if somewhat depressing. The lack of human rights standards, of course, is not because there's a lack of value statements, ethical frameworks, or normative criteria. I've just listed some of the ones that we've looked at. But the reality is that all of these standards set out the general criteria, which we all know: accountability, effectiveness, efficiency, feasibility, impact, propriety, relevance, sustainability, utility, with little to no connection to human rights. The fact of the matter is that the publications that do contain human rights standards really have a very weak reference to them at all, or refer to them as one of many standards that can be drawn upon without any meaningful hierarchical assessment of what complying with human rights standards means from the perspective of legality. And that's because human rights and human rights-based approaches not only prioritize human life, of course, and provide rules to manage rights, conflicts, and values trade-offs, but they also provide additional oversight and engagement measures that can help to support participation and democratic deliberation during times of emergency, and serve to minimize the risk of normalization of emergency measures beyond the pandemic itself. And I'd like to give you a quick practical example of what I mean when you look at some of the standards that you see on the screen in front of you. Human rights are sometimes located in a sort of subsidiary way to legality standards, or they're mentioned as part of an overall assessment of the culture and the context in which people are working. The reality, of course, is that the culture and context in which people are working may themselves violate or infringe human rights. And evaluators need to be alive to this. The fact of the matter as well is that these human rights standards exist as part of the international normative framework. They create legal obligations on states. And although evaluators are not necessarily lawyers, they do need to be aware of these standards and aware that they have a normative influence in all of the work that evaluators do. So why else should evaluators care? In addition to legality and looking at the rule of law, human rights standards are really just not one of many interchangeable principles. Again, they need to be seen in a hierarchical way, understanding the strong normative framework that they operate in. According to authors Eric Richardson and Colleen Devine, the legal consequences of failing to respect human rights standards in times of emergency itself creates a set of specific harms. Evaluators need to be sensitive to these risks, if only because of the evaluator's ethical imperative to do no harm. We've also heard about prioritizing vulnerable and marginalized people during the pandemic. But again, the reality was somewhat different when you look at the reality. All of the research we looked at between 2020 and 2022 showed that a range of originally vulnerable and marginalized groups became more vulnerable and more marginalized during the pandemic, and that evaluators during that period of time had relatively little to say about that. These groups included older persons, racialized and ethnic communities, and women, especially, of course, those in the caregiving community, people with disability, all of whom were grievously and disproportionately affected by the pandemic. Existing social fault lines were exacerbated while new ones yawned open, exposing systemic and structural forms of discrimination. A study by Camelia Janella et al. On human rights in Peru, looking at the pandemic, noted that the COVID-19 pandemic has brought attention to deep inequalities within the system, including gender and ethnic inequalities. The data also showed gross disparities in mortality rates during the pandemic for racialized groups, especially for Black and Indigenous persons, according to the APM Research Lab in a 2021 study. And in the United States, the Centers for Disease Control and Prevention have reported that Indigenous and Black individuals faced age-adjusted rates of 3.5 and 2.8 times, respectively, the risk of being hospitalized for the COVID-19 infection. And women, again, of course, disproportionately affected, especially racialized women, according to work by Mattioli et al. In 2020. So evaluators need to care, I think, about these issues, not only because of the learnings from the pandemic, not only because of the fact that, as Indran and Steve noted, evaluation was originally less present or overtaken by other knowledge providers during the pandemic, and as a result, in a sense, became less relevant. One of the chapters in the book by Peter Wilkins talks about this phenomenon in Australia, where evaluation was virtually invisible with regard to presentations given to parliamentary committees during the time of his study. So what do evaluators need to know about the rules of engagement when you're dealing with applying human rights during times of emergency? The overarching instrument is the International Covenant on Civil and Political Rights. It is an international human rights instrument or treaty that has been ratified by most countries of the world. And it provides that in times of public emergency, which threaten the life of the nation and the existence of which is officially proclaimed, that you can derogate based on the strict exigencies of the situation, provided the measures are not inconsistent with states' other obligations in international law. And here's one of the important bits. And do not involve discrimination solely on the grounds of race, color, sex, language, religion, or social origin. This matters because in the context of evaluating any measures that are put into place that either directly or indirectly have an adverse impact on groups in a discriminatory way, they're illegal under the international human rights law system, and therefore illegal under the national human rights systems, which incorporate basic human rights in their own constitutions. by their very nature, rules during emergencies are exceptional in nature, and that means that they can be justified to some extent, with the exception of discrimination, can be justified by the right to health and ensuring public health, the rights to life, liberty, and security of the person. That necessarily involves limits on dissent rights. So we saw, for example, limits on freedom of association, religion, the right to peaceful assembly, among others. And the reasons for this, of course, were clear, that you can impose restrictions that ensure that people are not kept together in closed spaces. You're trying to limit contagion, and you're trying to ensure that public health measures are promoted. But again, I think evaluators need to be aware of the fact that these limits must be proportional, and they must be restricted and tailored to the exigencies of the situation. These are some of the conditions that have been put forward in international law. The emergency powers must be necessary, proportionate, legitimate, time limited, and no broader than strictly needed. The official emergency has to be officially proclaimed. You can't derogate from certain rights, not only discrimination rights, but those include, and I hope that this would be obvious to everybody listening, the right to life, the right to be free from torture, the right to be free from slavery, the right to be considered a person in law. And it's not supposed to be, it's supposed to be retroactive, not retroactive, that there should not be retroactive penalties put into place that penalize people retroactively for behavior that was previously legal. Otherwise, again, the measures must be proportionate, or must have been proportionate and tailored to exigencies. So in conclusion, a few general points to make. The first one is that the pandemic showed us that human rights should be strengthened and not diminished in times of emergency. And that's because we now know that existing disparities in human rights violations, discriminatory impacts were heightened during the pandemic. And we also know that because of rules around governance and the way in which legislatures and parliament were suspended during the COVID-19 pandemic, that parliamentary oversight and legislative oversight virtually disappeared for a period of months, if not years, in many countries, meaning that there were no oversight measures or capacity to ensure that the normal mechanisms and safeguards that would have been in place can work. Since they couldn't, there needs to be continued and rigorous oversight of human rights measures. Well, what does this have to do with evaluators? It has a lot to do with evaluators, because evaluators need to be sensitive to derogations from basic rights in times of emergency. And I would argue that evaluators are especially well suited to assess proportionality and necessity, and to look at the empirical guidelines or the empirical results with regard to whether or not proportionality and necessity are indeed in place to justify the existence of derogations. And that's why the measures need to be put into place in a way that does respect proportionality. And again, I think these are especially well suited to evaluation practice. And finally, if evaluators are to maintain their own value proposition, the systems transformation that those who have spoken so far and others in the book, including Michael Quinn Patton, have argued for, necessarily have to place human rights at the top of the pyramid of the values and standards within the ethics of their own professional practice. Thank you very much.
Thank you, Pearl, for that very thoughtful presentation. And I think it really highlights, aspects of evaluation practice that we certainly need to be thinking about during emergency times, but also we need to be giving great thought to it during non-emergency times as well. So very great points for us to move forward with as a community. Thank you. Next up is Robert and Dorothy.
Thank you, Leslie. I want to first of all thank the Max Bell School for putting this webinar on and supporting. I think it's particularly important given the amount of time and effort that's been put into the research behind each of these chapters, and it's important for the evaluation community to get it out on the street. So again, thank you so much. Dorothy Lux and I carried out research that was exploring the impact of COVID on the effective use of evaluation in supporting the Sustainable Development Goals, the SDGs. And if we can just move to, Weston is providing our support. So I'm just going to say next, if we can go to the next slide. Thank you so much, Weston. I'll be leading off talking about the first question. The key question that we addressed was the impact on evaluation supporting SDGs, implementation, management, and reporting. And then Dorothy will speak to what are the lessons evaluators can draw from this, and what do evaluators need to do to adapt so as to remain relevant, not only to the SDGs, but country level needs. And I think as we walk through this, you're going to hear some parallels, some of the language that you've already heard to date. We're bringing this in focus to, or trying to bring it in focus to the Sustainable Development Goals. So what I'm going to do just to start off is to give a bit of background that provides a bit of context in terms of the SDGs. And some of that context is the pre-COVID experience. It's important to relate that as a starting point. Also, a bit of a snapshot on how we actually carried out this research. So if we can go to the next slide, the Sustainable Development Goals were adopted 2015 as part of the United Nations Agenda 2030. It's important to know that there's 17 of them, and across those 17, 169 targets have been identified in total, and 238 indicators have been developed to monitor them. It was recognized early on that being able to monitor progress on the SDGs would be important. So two key mechanisms were identified: global monitoring of specific indicators, and something that's been referred to as follow-up and review. It's a somewhat ambiguous term, and it doesn't automatically involve systematic evaluation. The evaluation community would certainly strongly indicate that, yes, it does, or it should, but experience to date would suggest otherwise. And finally, in terms of reporting, there is a mechanism called voluntary national reviews, where the VNR, where countries on an annual basis, on a voluntary basis, can basically showcase their progress at UN headquarters at a very high level and somewhat political experience annually. If we can go to the next slide, please. So we really wanted to just simply to highlight these 17 SDGs, simply to say that when you look at them in total, they're crossing all components and sectors that really would deal with a country's national strategy or plan. The goals, the targets are aspirational, and so they offer challenges on their own. But if we take them as a whole, it presents really a very complex situation. And it's that complexity where evaluation can really add value in supporting decision makers. And I think that is one of the key elements that needs to be stressed as we go forward. Next, please. The pre-COVID experience in terms of the use of evaluation, bit of a mixed bag. Despite strong support of UN agencies, the World Bank, and a variety of international networks, they were all recommending the use of evaluation to support SDG implementation and management and reporting. Evaluation of the SDGs really was held to a limited level at a country level when we look across the globe. In some sense, it's not surprising. Many countries actually have little or no experience or frankly capacity to be carrying out country-led evaluations. So this really, prior to COVID, was placing great importance on evaluation capacity building. and assistance required. And some headway and some momentum actually was occurring across the globe in this respect. Next, please. One of the realities we faced when Dorothy and I talked about this addressing these questions, it was actually limited hard data that related to answering the two questions. So we turned to a framework that would help us map out the key elements associated with the effective use of evaluation in supporting SDGs at a country level. And it was based on 4 elements. Leadership, SDG strategy and plans, national monitoring and evaluation capacity, and enablers for use. So together, these 4 elements would contribute to improving understanding, implementation, management, and sustainability of the SDG initiatives, and ultimately supporting those SDG principles and meeting SDG targets. So this is essentially the theory behind it. But underlying each of those 4 elements, we recognized there would be a need for critical success factors. This would help give form and direction for how a country could position itself. It's not one size fits all in terms of how this was being laid out. Much like a theory of change, we also recognize that each of the critical success factors to operate effectively needed to rely on underlying assumptions that had to be considered and tested. And this is where we were able to, through gathering information from a wide variety of sources, be able to make inferences about impact. Next, please. Because we have time limitations, I'm not going to walk through this, but simply to say that in broad terms, these critical success factors, they relate to the institutionalization, the organization, capacity, the space that a country was allowing for the SDGs and evaluation as well. Next, please. So pandemic impact on the use of evaluation supporting the SDGs. In broad terms, we can say parallels really what has been heard to date is it had significant impact. It had significant impact on the national monitoring and evaluation capacity building and evaluation use. And it was mainly negative. Indeed, all the critical success factors were negatively impacted by the pandemic. COVID drew attention away from the fundamental development challenges, and it also impacted the initial momentum that had been generated through SDG implementation. Not surprising, national priorities from SDGs shifted to COVID responses and to recovery. And for countries across the globe, it really represented a rebalancing of priorities. So progress against the SDG target stalled. In some cases, it worsened, and in particular for the most vulnerable in society. And as we've heard already, in terms of capacity building for evaluation and building national capabilities to evaluate, there was a pause in whatever momentum had been built towards evaluation capacity building. Priorities, resources of all countries, they were shifting to pandemic-related needs, and building evaluation capacity clearly was not deemed to be one of those needs. Next slide, please. But as we did the research, we also came to a conclusion that there were some positives and there were some opportunities that COVID did open up. Greater attention was being given to this word evidence and science-based and systematic analysis to inform decision makers. But evidence is quite an ambiguous term, as we see, particularly in today's world. During COVID, evaluators, they need to recognize that the evidence that was really being consumed by decision makers was quantitative evidence and mathematical modeling. Less attention and focus was being given to more in-depth social science approaches, which would be typical of evaluation. There was new attention being brought because of the impact on the most vulnerable. New attention was being brought to the SDG principle of no one left behind, and that has really continued. And the other thing that is potentially a positive is that the pandemic may have raised the awareness and a sense of urgency among leaders on the need to deal with threats that are global in nature. And one can specifically turn to SDGs 13, 14, 15, and 17. One might say that the period of the global pandemic could be considered as an opportunity in that it allowed for a reflective pause in the history of the world. Now we push the reset button. Where are we? And Dorothy will be speaking to that. But I have one more slide speaking on impact on evaluation practice. The fact that evaluation capacity building stalled during the pandemic, this notion of reset really was recognized as needed among key international players in going forward. In practical terms, pandemic had a significant impact on the compilation and dissemination of official national statistics. And frankly, it became a major impediment for data capture, which would be essential for both monitoring and evaluation. As we have all experienced, remote data and information collection, digital meetings have all become prevalent and they've become normalized. Frankly, it's a two-edged sword. I think we need to recognize that for both evaluation practice and training. The new normal during the pandemic created challenges for effective supervision of monitoring, evaluation, and learning quality. The other thing, and this was echoed by a few of the speakers already, is that traditional evaluation and timeliness, the timeliness typically taken in carrying out evaluation, it didn't meet the needs of decision makers during the pandemic period. A shift in focus really was created, and it created uncertainty around the role of evaluation during the pandemic. So I think really as a segue to Dorothy's piece, we need to think of bringing evaluation closer to decision makers in a timely fashion as we look at the way ahead. I'm going to turn now to Dorothy, who will speak to the lessons and implications for evaluation.
Thanks, Bob. And moving ahead into the second question that we looked at then is, post-COVID, are the SDGs still relevant? Is the 2030 agenda still relevant? And what role does evaluation play? And we saw that evaluation has not yet played a significant role, but actually there are emerging lessons, which means that evaluation can take a much stronger role. Next slide, please. So if we look at the framework that we used for this piece of work, there were four main aspects around leadership, the systems that we work with, around context, and most particularly, which Indran mentioned as well, around use. So if you look at then what are the key messages that we take from this and what are the building blocks for the future? And I'll just touch on these, you'll have the slides afterwards. But this aspect of the value added of evaluation and the leadership role of evaluations as trusted advisors. So the capacity of evaluators to actually integrate into decision making. And we've heard a few of the speakers talk about that. as to how evaluations need to be placed right next to decision making. And we also looked at the 2030 agenda, which is not just the SDGs, but the application of principles. If you look at the 2030 agenda and the articles 7 to 13, there's a range of really strong principles in there, which bring in aspects of human rights and many other aspects which can be applied in evaluation, even if we're not talking specific SDGs. So then that means that evaluation tools need to shift. And a number of the speakers have already talked about that, so I won't dwell on it. But what I will touch on is the context of evaluations, this aspect of zooming in on specific aspects in evaluation, but then zooming out and saying, how does this apply in the global context, in the global environment? And this is what COVID taught us very much so. There's been a focus on evaluation training, and one of the things we learned was that evaluator training needs to be broader based. And next slide, please. There's one aspect that's very important, and that's evaluator as a facilitator. And we don't tend to teach facilitation skills, but facilitation skills lead to improved applicability in the context of the SDGs. Because as a facilitator, you look at complexity, you look at interrelationships, the aspect that Indran was talking about of the integration between sectors, different approaches, multi-sectoral approaches, and the evaluative thinking using SDG approaches. We can support SDG implementation in non-traditional ways and formative learning, applying complex theories of change and nested theories of change, and not letting the independence role limit. We are not saying that evaluation shouldn't be independent. Absolutely it should, but there is a way to add value to that, and then of course drilling down to analyze outcomes for disadvantaged people in the same way as Pearl was talking about. Next slide, please. Then touching on evaluability, this is an area where evaluations can touch more on evaluability for the SDGs. So investing in understanding the country level, but also subnational and sectoral levels, and building that into valuation, using obviously quantitative, but also the qualitative analysis beyond SDG statistical analysis alone, and shifting beyond the indicators, targets, and monitoring to knowledge building for the SDGs. How does evaluation work to build that? And looking at much more proactive engagement of players early on in evaluations, helping to bridge that gap between SDGs as aspirational and the actual how-to, the processes of implementation and evaluating those. And finally, not just looking at the SDGs, but a roadmap to recognize the use of the SDGs moving forward. So SDGs are still relevant, but evaluation needs to help in making sure that that is so for the future in a very practical way. So thank you, and I'll hand back to Leslie. Our contact details are there on the next slide if there are any questions.
Wonderful. Thank you both for a really engaging presentation, helping us to think about how we can effectively support SDGs as we move forward, and from the lessons learned that you all gathered. Next up is Jeremy.
Good afternoon. Good afternoon from a cold northern England. So this is a chapter that Mariel unfortunately Mariel isn't with us. This chapter is called Production Endemic Support. two state audit institutions, the UK National Audit Office and the Office of the Auditor General in Canada, sought to produce useful knowledge for the purposes of accountability and learning in the exceptionally testing circumstances of the COVID pandemic during 2020 and 2021. Worth just sort of emphasising, state audit institutions are independent bodies set up to support parliamentary scrutiny of public expenditure. They vary quite a lot around the world, but usually have multiple roles, of which the most important are auditing government accounts and undertaking evaluative and more reflective work, often called performance audit or value for money audit. So the chapter considers how this more evaluative work, performance audits, investigations, and lessons learned outputs was used to provide valuable information and knowledge to government officials and legislators at pace in an environment in which doing, such as keeping people safe and securing and deploying protective equipment and so on, rather than recording and rendering an account to others, was the highest priority for government and for those on the front line in the pandemic. And such work, nevertheless, serves as an important purpose if societies are to learn from the experience of the pandemic. And so I think, as we say in the chapter, if newspapers are sometimes considered to be the first draft of history, it's possible that some of the audit reports produced by the state audit bodies are the preliminary scoping papers and useful evidence sources for the inevitable inquiries which have been undertaken in different countries. Our starting point really is that many of the most important preconditions for performance audit work, which are normally present, were challenged by the pandemic. So the collection and assurance of performance and financial data was extremely difficult. The ability to undertake site inspections or audits for verification purposes was often impossible. The ability to conduct interviews and group discussions to collect contextual information was either difficult or not possible. And the availability of public officials to explain their audit experience was also severely hampered, delayed, meetings postponed or abandoned as a result of the pandemic. Nevertheless, in many ways, the need for scrutiny of public expenditure and indeed revenue collection was probably greater than normal during and as a result of the pandemic. The pandemic raised considerable concerns about how public money was spent on a scale previously considered unimaginable. For example, on furlough schemes and supporting whole sectors of the economy, procurement and production of unprecedented quantities of PPE, for example, and some highly innovative work around vaccines. And normal activities that would have proceeded slowly were rushed through with minimal supervision, raising all kinds of delivery risks. So these were all really challenges to the routine rules-based environment of which audit and state audit institutions are a part. And subsequently, in a number of countries, including the UK, there have been concerns raised about fraud and exceptionally poor value for money, which have materialised. So the opportunity for waste was enormous. In these circumstances, parliamentarians and the media struggled to keep up with what was happening. And in the case of parliamentarians for whom national audit offices routinely work, they were looking for assistance and information. And so the chapter really looks at the role that SAIs played, the state audit institutions in the UK and Canada played in trying to help legislators to keep track of what was happening. There was immediate impact for auditors in the same way as there were for everybody else. The NEO was immediately forced to adapt its working practices so that working from home became routine in the middle of March. and indeed continued to be so for the majority of staff for about 18 months, followed by increased use of hybrid working. There was initially not immediate problems. Quite a lot of work was obviously underway, and finalising reports and publishing often didn't require contact with others outside the organisation, and discussion of reports and so on. The usual processes could carry on online. Teams quickly learned and adapted to making use of Teams and Skype and so on. And in actual fact, there were sort of immediate efficiency gains with sort of long traditional expectations of how work should be done, which usually involved teams of people traveling often quite long distances and staying away, suddenly being abandoned, and the ability to hold meetings online led to immediate cash savings. The Parliamentary Committee in the UK, which I'm familiar with, having worked in the NEO through this period, met online. So the audit teams that supported the parliamentarians supported them without difficulty in meetings which went online or became hybrid. There obviously was an impact on the work programme, and in the case of the UK, where the legislation is fairly flexible, well, very flexible, the programme of reports was changed very quickly, and a shift to assess preparedness, to look at spending on the direct health response and the wider emergency response. His work was fitted in fairly seamlessly. Reference has been made earlier in this this webinar to the previous book that Maria Barrados and I edited on crossover of audit and evaluation practices, and in there I wrote a chapter about the sort of changing environment for performance audit. And I think what we say in a chapter around COVID is that the experience of COVID accelerated and accentuated many of the changes which were already taking place. And by that, I would underline it increased the pressure to report very quickly. And so initial UK NEO reports on the government response to the pandemic were published within a few weeks of the lockdown in the UK in May 2020. An investigation into the rollout of vaccines was carried out in a few weeks, and was being updated just prior to publication to ensure that it was kept current. This obviously underlined the need for also for more risk-taking reporting because of the pace that was required for reporting, and it emphasised the importance of even more rigorous sort of internal quality controls and assurance around the evidence base. But nevertheless, I think what it did do was led to a certain amount of flexibility around the use, for example, of public domain material, which wouldn't normally be inserted into audit reports. But there was a sense in which any information at this time was better than none. It pushed the NEO to diversify its outputs, and I'll say a little bit more about that in a minute. But one of the innovations that was instituted was something called a COVID cost tracker, which drew together details of all government expenditure relating to COVID. This was published for the first time in May 2020, and it was updated regularly thereafter to give a detailed and searchable record of information that was available about what was being spent and by which government bodies. And I think this really underlines the fact that parliamentarians were really seeking some fairly basic information, and it was interesting that it was the Audit Office rather than the UK Treasury, the Ministry of Finance, that produced this, and it became seen as an authoritative schedule which showed exactly what was being spent. And I think it underlines, I think, that in these emergency circumstances, some very basic questions were what people wanted the answers to, one of which was what is being spent and where. So in terms of what was produced in the UK context, as I say, the COVID cost tracker was one innovation that was introduced very quickly. There was a series of very short turnaround investigations, which were factual rather than evaluative in nature. And again, this was designed to set out and put facts into the public interest. This was a type of report which had been produced by the NAO for some years, but it seemed to have seemed to definitely come into its own in the course of the COVID pandemic, because there were quick turnaround factual reports on subjects, for example, like ventilator procurement, on loan schemes, on different aspects of government procurement, and other subjects such as support for charities and various recovery funds in different sectors of the economy. There were, in addition, more evaluative reports, which took longer, and sectors such, for example, as looking at the development and tackling of the backlog in criminal court cases, and so on. Two other types of product which were produced in the course of the pandemic were lessons learned outputs. This was something in 2021 where the UK NAO, having produced 17 reports on different aspects of the response to the pandemic, the NAO drew together a series of broader lessons and themes around risks to value for money, transparency and public trust, data and evidence collection, and so on, coordination and different delivery models. And then finally, probably even more kind of valuable at the level of organizations, public sector organizations, was some practical guidance that was produced and published in 2021 to try and to assist organizations in the challenging circumstances, covering things like financial reporting, organizational control environment, and the regularity of expenditure, which were areas where organizations were particularly tested by the manner in which the pandemic had affected their organizations. Turning to Canada, I mean, Maria, if she was here, would obviously be able to talk in more detail here. I think one of the themes that came out of the work was that the Office of the Auditor General in Canada experienced similar impacts in terms of employees working remotely, and many of the same challenges around obtaining audit evidence given organizations. As part of the OAG's response, there was collaboration with federal organisations that had audited and with central agencies in the federal government to adapt to these circumstances and to try and develop workable solutions appropriate to both parties to complete audit work. And as in the UK, there was focus on the new risks or the enhanced risks that had been exacerbated by the pandemic in relation to financial reporting and susceptibilities, for example, to breaches in digital security and the increased fraud and so on. So, although different circumstances in UK and Canada, the basic challenges were not dissimilar. And so in the chapter, we talk about those. In many areas, basic data was challenging to collect or was not available at all. As I said, gaining access to officials or operational sites in both countries was particularly difficult and indeed impossible at times. The normal criteria for judging performance really was necessarily tempered by the realities of the situation. And so in the course of reporting to Parliament in a number of occasions, there was a clear effort made to emphasize that conclusions conclusions caveated at times by recognition of the exceptional circumstances and the trade-offs between speed, effectiveness, cost, and control in the in the circumstances of the pandemic. But at the same time, there was an emphasis on expectations of appropriate conduct in public business remaining, particularly given the scale of spending, which became increasingly a cause of concern within Parliament. And so, as a result, concerns were expressed in reports, for example, about a lack of transparency around key decision-making, particularly, for example, where suppliers were chosen for large contracts involving billions of pounds. So I think in conclusion, the overall conclusion, I think, of the chapter is relatively positive in the in both countries. And I think we tried to sort of draw out some reasons behind this. I mean, we think that the state audit institutions in both countries managed to step up, and the reasons behind this, I think, was that there was clear demand for the information that the audit officers were able to provide, and I think both state audit institutions knew what was expected of them, and they continued to provide that. There was no question that the kind of material that they were generating, the kind of knowledge and insight that they were able to generate, was important. There wasn't really any suggestion of anything nice to have, and indeed, work in both countries was abandoned on areas which were of lower priority. But there was definite demand for the information. I think it's fair to say that some public officials were clearly wary of the idea that in the course of trying to push and deliver in whatever sector of the public sector that they continued to be audited. But actually, I think a lot of senior officials recognise the importance of there being a clear independent record of how money had been spent, how decisions had been made, and what had happened as a result. And so, and I think also what's important is that both audit officers were able to take advantage of their existing knowledge and their existing contacts and their existing presence within government departments. Were able to exploit, particularly in the case of the UK NAO, their increasing experience in recent years of faster delivery of audit products. And it's possibly the main difference between the two countries, the two audit offices, was that the NAO's legislation provided greater flexibility to be able to flex its work program more than in Canada. And finally, just taking a step back and trying to think about longer term lessons from the experience, I think there is, in the first case, I think a recognition of the risk of audit not going online, and the risk of losing the personal touch, and the risks associated with not visiting places and building relationships with people. So I think whilst the experience of moving to sort of online auditing and reporting was successful for the purposes of the pandemic, it isn't. It's something that can be integrated into rather than replace traditional, more personal approaches. I guess what I'm saying is exchanging emails is not the same as meeting people. Secondly, I think work at pace, but not sacrificing what we might call slow audit, the importance of independent data capture, the importance of a variety of data sources, and so on. And then finally, I think also need to be aware of the risk of undermining sort of internal cohesion within the organisation, which is associated with teams not working together. So I think important to get staff together and to move to a more hybrid approach. Online was fine for the purposes of the pandemic, but definitely organisations, audit offices are not the only ones. I think starting to recognise the importance of people working together. So I will leave it there.
Wonderful. Thank you, Jeremy, for those comments. Ray, you're up next to offer some words of reflection here. So I'll turn it over to you. We have a few questions in the chat, so maybe the speakers can start looking through those so we can see if we might be able to respond to at least a couple before we're able to log off.
Leslie, thank you very much. And I want to thank Max Bell School for helping to set this up and to make it such a success. This is just great. So I have kind of a set of 5 observations, sort of trying to tie this all together. And as I wrote these words here in the fall of 2023, the global death toll from COVID-19 was estimated at least 15 million. And that's the death toll, 15 million. And the estimate is in fact only partial, because the actual numbers may be much higher, maybe 2 times as high. A recent edition of the medical journal, The Lancet, which comes from the UK, estimated at least 18.2 million deaths from COVID-19. So there's also the controversy about whether India has actually released its complete data. And so consequently, that number at 18.2 may be well below whatever the total amount is, given the experience of India. Now, in many parts of the world, people do not have access to hospitals. They don't have access to medical clinics. They don't have access to testing and health professionals. So the numbers are I mean, this is an interesting issue in evaluation. The numbers may be approximate, and they may stay approximate for quite a while as to whether and what this actual size of the COVID-19 death toll in the world is. Let alone that we also don't have a really tight estimate of what the vaccine rate has been in the world. So, you know, it's an uneven picture. And now we superimpose that on the biggest health and humanitarian crisis in more than a generation. What follows are 5 sets of brief observations that deserve evaluators' attention as we move into the 4th year of the pandemic. The numbers are huge. I mean, this is the millions and millions of people who have died from this pandemic. But the observations here are brief. The crisis is still underway. We're not past it. I mean, there's a certain effort by a lot of people to say, well, yes, I don't have to mask now. I don't have to stay away from others, so on. But it's not that way, in fact. There is still a lot of illness. There is some death, and there is a lot of hospitalizations that are still underway. We can observe trends and tendencies, but the world is still in the midst of illness, death, and new infections every day. So we've got to be cautious and circumspect, because it's the right thing to do. We're not totally guessing, but we're not totally firm in terms of what we have in front of us. Broad pronouncements are neither warranted nor required, but brief, careful, ongoing evaluation studies are mandated. Thus the brevity. Furthermore, as my friend Joe Stiglitz has written, even as we emerge, quote, even as we emerge from this crisis, we should be aware that some other crises surely lurk around the corner. We can't predict what the next one will look like, other than it'll be different than the last, end quote. So now, 5 observations. Observation 1, an emergent trend from the pandemic is that It is strengthening the institutionalization and reach of big government. This stands in contrast to several previous decades in which the role of government has been reduced in size and scope as societies have increasingly relied on the market. As Schwab and Milleret have observed, this is a situation that is set to change because it is hard to imagine how an exogenous shock of such a magnitude as the one inflicted by COVID-19 could be addressed with purely market-based solutions. Already and almost overnight, the virus has succeeded in altering perceptions about the complex and delicate balance between the private and public realms in favor of the latter. So how will we know that government is indeed expanding and pushing the market into a lesser role? Key means of knowing this, I think, is to examine the relationship of government to the economy. The interventions of government have not been painless, but they've been quick. It's also been without precedent since the Second World War. I think this is important. This is the single largest phenomenon of expenditure in governments since World War II. The scale of stimuli programs is in the trillions of dollars to support the welfare of citizens and maintain employment. It can't be overestimated what this has meant. The support for this has not come from markets. It's come from governments. Only governments have the resources to do what is needed, and without government intervention, we'd be in a much deeper mess. Yeah, for sure. This observation, I think, is worthy of careful investigation and deeper analysis. Observation 2. The pandemic has exposed some deep structural flaws and frailties in our societies. And we've heard a number of these discussed today. These include weaknesses in how we treat the elderly, the poor, minorities, children, and our response to the care economy. All of these are contexts and populations in which we have not created an appropriate level of societal responsibility, nor responded adequately to their individual needs. Indeed, it can be argued that persons in these groups, those persons most often infected, most often in the lower income brackets, were on the first line of defense during the pandemic, but were overlooked, ignored, and left more vulnerable to COVID-19. Infections that rampaged through our countries, and I use that term advisedly, that they rampaged through our countries. They were also most frequently omitted from early access to the vaccines, leading to disproportionate high death rates. As a result, we have broken the tenuous social contract with persons in these groups. This is most clear in relation to how we address and respond to the broad issues of inequality and marginalization. How we choose to respond as individual societies will be one of the definitive characteristics of the post-pandemic era. This topic also merits close attention from evaluators in the months and years to come. The question of our own structural flaws and frailties. Observation 3. The COVID-19 crisis has exposed the glaring inequality, the glaring inadequate status of many, if not most, national health systems. For the United States, for example, to have thus far lost more than 1 million lives is simply so unacceptable as to be unspeakable. For one of the wealthiest nations on earth to have tolerated this level of death and disease is so far from being defensible as to be immoral, and I use that term advisedly. This links in a profound way back to the proposition observation 2, a recognition of deep structural flaws in how we presently organize our societies. Again, how we propose to respond will be among the most defining characteristics the post-pandemic era. At present, it is evident that the pandemic is no great leveler. If evaluators can dig into seeking understanding in the dynamics of this set of inequalities. Observation 4. The cost of misinformation is considerable. Quote, freaking miracle. This is how health journalist Helen Branswell describes the vaccines that saved millions of lives from COVID-19. The vaccines developed and offered in countless countries have proven to be 90% effective against the infection. They are safe and also relevant. They are often free. But sadly, there are many who think otherwise. They hold to conspiracy theories about the vaccines. A recent survey in the United States of 18,782 persons, across all 50 states, by the way, were asked about 4 vaccine misinformation claims, asking respondents if the claim was true or false, if the person was not sure. True or false? The vaccines contained microchips. 5% said true. The vaccine contained aborted fetal cells. 7% said true. The vaccine can alter human DNA. 8% agreed that it was true. The vaccines can cause infertility. 10% thought this to be true. And a full 46% were uncertain about the veracity of any one of the 4 claims. Misinformation about vaccines is directly correlated with whether persons get the jab. The survey showed that among those who did not believe any of the false statements, that none were true, 80% were already vaccinated. In the group that thought one or more of the false statements was true, 60% have not been vaccinated. And the data show persons who do not get the vaccine, actually just any of the first shots, are 14 times more likely to die from COVID than the vaccinated persons. Thus the question, how many of the more than 1,006,000 deaths, documented deaths in the United States, could have been averted with the vaccine? Clearly the answer is many. Personally, I've lost 2 friends, one who died before the vaccine was discovered and another who died after the vaccine was discovered, but distrusts the federal government to administer anything to their body. Studies of the resistance to the shots by demographics, religion, politics, and social economic status are all fruitful areas for evaluators to work and to start unpacking the causal connections. Observation 5. Many commentators have spoken and written of eventually going back normal, however normal is defined. But this is not possible. It's not going to be. The turmoil of COVID-19 will not be reversed ever in its entirety. For example, the tension between the economy and public health will not disappear, particularly as some argue it was acceptable to sacrifice the few, in this case the elderly, for the sake of the economy. This was a rather shocking proposition that had been expressed by the Texas Lieutenant Governor Dan Patrick. This is a false and potentially deadly trade-off. So, dear colleagues, I recommend these considerations to you while we are all still in the process of working through the implications of this vast challenge to our lives and to our societies. It's not over, by the way. It's not over. The virus is not yet done with us. And even when that time comes, as Joe Stiglitz notes, another crisis will grab our attention, our pocketbooks, and even our lives. We need to stay alert and prepared. because COVID-19 is an example of what happens when we are neither alert nor prepared. Thank you. Leslie, I'm back to you.
Thank you very much, Ray, for those closing remarks. So thank you, everybody, for joining. Thank you for the wonderful presentations today. Extremely thoughtful, very reflective, and I think speaking on behalf of the broader evaluation community, we really appreciate this thoughtfulness so we can think about how to move forward. Yes, Ray.
Leslie, can I add one comment?
Please.
This book, for everyone who participated today, this book is open access.
Yes.
And I just think that ought to be reinforced, because any of you who would like a copy can get it free. And
Yes.
that's very generous to us from Indran and his team. And consequently, it's available to anyone who seriously wants to deal with any of this, that the open access availability is not to be discarded or to be treated lightly.
Absolutely not. Thank you, Ray, for raising that. Very good. Well, we will close out on that note and encourage you to get your copy of the book and read through it in detail. Thanks so much, everybody.
Thanks,
And
Leslie.
have a great rest of your
Thanks,
day.
everyone. Take
Thank
care.
you.
Bye.
Thank you.
Bye now.
Thank you. Bye, Ray, Paul.
Bye,
See you.
everybody.
Albert.
Bye-bye.
Thanks, Leslie.